My name is Dr. Keith Radbill, and I'm a board-certified physician and the medical director here at Renew Us. And today in this video, I want to talk about bioidentical hormone replacement with subcutaneous pellets. Now, there are many ways to deliver hormones to a patient. There is injectable, there's oral, there's topical, and there's subcutaneous pellets. Now, the problem with oral, many of these oral hormones, they're FDA approved, they're synthetic, they're conjugated in the case of estrogens, meaning they're equine, horse estrogen. And when you take a hormone orally, whether or not it's bioidentical or synthetic, it gets absorbed through the gut, goes to the liver, and that can affect clotting factors, which is where we hear people have an increased risk for blood clots and other side effects. However, when you receive the hormone subcutaneously under the skin, number one, you're getting bioidentical hormone, and you're not getting any liver metabolism, so there's no increased risk for blood clots. With the pellets, they're implanted in the area posterior to the hip in the fatty tissue. Now, the fatty tissue has lots of blood vessels, and as the heart pumps, it picks up the hormone into your system, and it gets it to a nice high peak level. Now, if you exercise or go up the stairs, your heart rate's going to go up, you're going to get increased blood flow, it's going to get increased levels of the hormone, and you're going to get higher levels of the hormone, which really exactly mimics what your body did when we were young. With injections, you really don't have that opportunity because you'll get what's called, you get the injection, the hormone levels go up in 3 to 4 days and peaks, and then it starts to drop off after about the 7th to 10th day. And patients will frequently tell me, well, I feel great, but then it starts to wear off before I receive my next injection. Another thing with the pellets is, I've said they're bioidentical, but a lot of people think we're putting plastic pellets. There's nothing plastic or anything that has to be removed. It's purely just the hormone compressed under high pressure into a tiny little rice-sized pellet. Now, some symptoms of low hormones would be fatigue, irritability, low libido, difficulty sleeping, insomnia, body aches, and things like that. So also my patients will say that they're exercising, but they're not getting the results that they used to get. Now, as we get over age 30, our hormone levels drop every single year for the rest of our lives. And what happens? We lose muscle mass, and our bodies change. You may exercise just as much as you did previously. You may exercise more, but you'll still notice increased abdominal adipose tissue and decreased muscle mass over the years. At Renew Us, we use Biotene Medical as our hormone provider. Biotene Medical is one of the nation's leaders with regards to bioidentical hormone replacement therapy. They've had over 1 million insertions performed, and the unique thing is that each dose is calculated for each patient as a distinct, unique individual. So if I give somebody, let's say, blood pressure medication or cholesterol medication, or I'm treating whatever disorder, everyone gets basically the same starting dose, and that dose is increased until we get the desired effect or clinical efficacy. With the hormones, we're able to individualize that therapy based on your age and your weight and your labs. And we put this into a portal, and it calculates the exact dose necessary for us to get excellent results in every single patient. In addition, our treatment is really not limited to just your hormones. We look at your diet, we look at exercise, we look at a patient's cholesterol, we look at their blood sugars, you look at their thyroid, and we come about with a whole plan to treat all of these things, to get our patients not only feeling great, but also healthier than they've ever been before. Now, the procedure to administer the pellets is a 5-minute procedure. It's very simple. It involves minimal to no pain. We use an area posterior to the hip and the fatty tissue on the back, and we insert the pellets. There's no sutures involved. We just put a little steri strip over there, and then we put a bandage on that keeps water out. We don't want to submerge this area for the first 7 days. You can get it wet in a shower, but usually just to keep it dry for 7 days, and also no exercise of the gluteal muscles for the next 7 days. Now, people will sometimes ask me, well, why are my hormone levels so low? Why do I need this? And the answer is really physiologic and environmental. So going back to the 1990s, men's testosterone levels were really 200 points higher at the same age than they are now. And the reason for that is we think because of our diets, the obesity epidemic, but also the advent of smartphones and iPads and computers, we live more sedentary lifestyles. We're not getting as much exercise, and this is also contributing to the lower hormone levels. So our job here at Renew Us is to support you in this treatment process while at the same time providing protection from disease processes through nutrition, exercise, supplements, diet, and even medications when indicated. So some fears that my patients have regarding hormone replacement. The number one thing I hear is I'm afraid of blood clots and breast cancer. And I have patients tell me, I've had blood clots, I can't do this. Well, actually that fear is misguided. Like I said earlier, if you take a hormone orally, a synthetic hormone, a conjugated hormone, you're going to get liver metabolism. Yes, it will increase blood clots. And the studies in 1999 and 2002 with the conjugated estrogens also showed an increased risk of breast cancer. However, we're not giving these medications orally, and we're using bioidentical hormones. In women with estrogen, 17-beta-estradiol, that's their natural estrogen. That's what they get. There is no increased risk for blood clots when the hormones are emitted subcutaneously, when the hormones are administered subcutaneously, and there's no increased risk of breast cancer. The other question that patients say to me is, well, this is not really a time-tested procedure, the pellets, and it's only been around a short time. Well, that's because patients have only heard about it recently. Pelleting has been around since 1939 using testosterone and estradiol in patients. And not only that, it's one of the, it's commonly used all throughout Europe and Australia. The final thing I get asked very often from patients is, how long do I have to do this? This is a common question with anything, even cholesterol medication. And my answer to this is usually, if let's say the patient's 60 years old, they're on treatment, they feel great. And I say, well, do you think in 10 years when you're 70, you're going to say, I want to feel old. I don't want to feel good anymore. I want to feel my age. I'm going to stop. So really the answer is indefinitely. You can stay on this for the rest of your lives. I have one example, a gentleman I put pellets in, who I was doing it for the first time, but he had been getting the hormone replacement with the pellets for many years before. He was 80. He hopped up on the table like it was nothing. He was thin. He was fit. He had a great attitude. And I said to him, how long have you been getting this done? And he said to me, not long enough. I said, well, how long has that been? He said, since I'm 72. So he was getting the pellets for 8 years, and he said, I golf every day. I exercise. I feel great. I tell all my friends about this. So there's no age limit on getting this procedure done. It's really about feeling great and being healthier. Now, if you're interested in this or any of our other treatments, like I said, we do an entire program of wellness revolving around weight and lipids and hormones and blood sugars and everything. But if you're interested, go to our webpage at renewus.com, or you can check us out on our Facebook page, or call us at our phone number, 888-985-2727. Thank you.